Can you walk me through a patient case study that you did with relating to osteoporosis, bone health, etc.?
I can. Yep. So this is somebody that I'm working with currently. Now, the one thing I do want to point out is that, as I think it's become evident, unlike some of the conditions that we are treating at MedMatrix or in functional medicine in general, where we can kind of gauge the success of our treatments relatively quickly, by how the person feels 3 months later, 6 months later. Things like bone mineral density, like this is, we're in this for the long haul, right? People aren't getting DEXA scans every 3 months. They shouldn't. So just to have that kind of caveat that, I'm working with people for a long time, and sometimes success simply means they haven't fallen, or they fell and they didn't break something. Mm-hmm. This case is a woman that I'm working with right now. She is 68. She came to me originally for primarily digestive issues, so chronic heartburn, chronic gastroesophageal reflux disease, GERD. In addition, she has known for a while that she has osteoporosis. So she came to me taking omeprazole, which again is one of those proton pump inhibitors. Again, had been on it for quite a long time. Was also on, I think she's still on alendronate, which is a bisphosphonate, one of the more common ones. Trade name is Fosamax. Again, she's been on that for a long time, but her most recent DEXA scan did not show any improvement. I don't remember exactly what her T-score is, but it's in the osteoporosis window, not osteopenic. So her at her first visit, I saw on her blood work that she was deficient in vitamin D. I put her on a decent amount. I might have just started her even on just 5,000 IUs, which is, in my opinion, not a lot. 5,000 IUs of D3 with K2. We started working on her gut health. She saw her primary care provider, who either tested her vitamin D, or I think they tested her vitamin D, and it was came back at 33, and they told her that was too high, and they wanted her to stop her D3 supplement. So again, it's just a difference of opinion. We don't really see people getting into toxicity levels until it's like around 150. But conventional medicine feels like anything like 33 is too high. But for her bone mineral density, I wanted her to be like at 80.
So what do you do? Just curious, like, I'm sorry to interrupt the story, but like, what do you do in that scenario? Because like,
I say exactly what I just said to you. I say this is a difference of opinion. I say I am prioritizing your bone mineral density, and this is what we see for optimal calcium absorption is that we want to keep your vitamin D elevated, and we are a long ways away, in my opinion, from what I have read and what I have learned. We are a long ways away from toxic levels.
Man, that sucks for the patient, because then they're like kind of between a
torn. Exactly right.
Yeah, that's really tough.
Yeah. So a little bit of she does have a couple, there's been a couple fractures, I think, in the wrist. Mm-hmm. So I changed the form of her calcium to calcium citrate because it's more absorbable. Again, I've been like optimizing her gut health. So she has been able kind of on her own to get off of that proton pump inhibitor. So right there, she's lowered her risk, right? I mean, it'll take a little while, but basically just by being off of that, she no longer has that compounded risk. And so so she was able to do that with some nutraceuticals. And I did start her on some bioidentical HRT. Again, she is a little bit older, like how much are we going to gain? We are going to get some gains from that, not as much as we would if she were 10 years younger, but it's still better than not at all, and it's still safe. And I feel like the benefits outweigh any kind of risks for her. And then I might be considering kind of some additional hormonal balancing to just again continue to optimize that like the skeletal muscle mass as well as the bone mineral density. So she's really exercise wise. She's maybe unknowingly been focusing on cardio, but I'm also trying to help her incorporate more weights and more of an emphasis on balance and flexibility.
Awesome.
So, yeah. So again, I don't
rough.
have a, oh, look, her DEXA scan is now amazing, but I think we're going in the right direction.
Yeah. I mean, what's awesome is she got off the
The PPIs. Yeah.
Yeah, that's pretty cool.